This segment of the Plastic Surgery Channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
I'm Dr. Bill Adams, and this is No Spin Live, and we have a great show for you today, and we've got a great team of experts to give you what you want to know about plastic surgery. Today, we'll be talking about do-it-yourself plastic surgery, Catherine Zeta-Jones and her Instagram postings, and a patient who strips down to their underwear in protest. With us today, we've got a great crew. We've got Dr. Jason Posner from Boca Raton, Florida, although he's in his car in traffic. And we got Dr. Dan Delvecchio from Boston, Mass. Last but not least, we've got Dr. Mark Pinsky from Palm Beach Gardens, Florida. Well, let's get right into it. We've got a lot to talk about. This came across our desk, emailed from a viewer. This is about do-it-yourself plastic surgery. Some people go to the plastic surgeon. Some people want to do it themselves. So they've got lip reshapers. They've got jaw enlargers. They've got nasal slimmers. Do these things work? Delvecchio, start us off.
There's a spectrum of self-improvement from, makeup, hair coloring to self-surgery. And where we live on that line depends on how crazy we are. And so I think that there's a place for these if you think about ear shapers at birth, you can avoid an otoplasty. I think that there are some gimmicks at home that you can use to make your nose stick out more. I've seen patients who have under projecting tips with these nasal struts that they put in their nostrils. So, it's like putting heel elevators in your shoes, Bill, if you're not 6'4" like you. Short guys like me and Posner, we have to wear the heel elevators. So I think that there's a spectrum, and I think it's reasonable.
All right, I'm 6'5", DDV. Mark, what do you think?
Well, I have to tell you where Dr. Posner and I are from, there's a lot of crazy stuff that goes on in South Florida. People doing buttock augmentations with materials that you could buy at the hardware store in someone's garage. They're doing the procedure, or in a bedroom. There are non-certified plastic surgeons doing all sorts of crazy and bizarre stuff, and people just doing things on their friends. It's just it's some places it's the wild, wild west. The things that Dan's talking about, that's fine. Nobody gets hurt, no harm, no foul. But a lot of people are crossing the line and trying to charge money, injecting products into the face, into the lips. And it can be a nightmare. It's just some really bad stuff.
So I'm going to take a little different tack than the other guys. I think that there's some very, very valuable home use devices out there, starting with skin rollers that are used for acne scarring. There's home hair removal devices that work. There are home acne devices that work. So there's lots of good things that have been tested that works. There's certainly a lot of crap, people doing stupid things to themselves. The latest device out there that I'm familiar with, and Dan knows about this, is a home vaginal tightening device that has heat and LEDs in it. So I think there are some very valuable home use devices out there, but it's hard to figure out what's good and what's a bunch of crap. So that's why I think things that are sold in doctors' offices or recommended by, board certified plastic surgeons have a little bit more merit than some of the crap that you might find on Alibaba or Amazon.
Let's move on. We're going to go on to Catherine Zeta-Jones, the well-known actress. Actually, this is about her Instagram account. We're going to stick with you, Delvecchio, because I think you're the only one that has more Instagram followers than Catherine Zeta-Jones, and so you'll probably the best to comment on this. But she's posted a bunch of pictures of herself recently. I think she looks pretty good, but apparently a lot of her big fans feel like she looks weird and that she must have gone under the knife, and she's kind of being thrown under the bus a little bit. What do you think?
I think Catherine Zeta-Jones is a beautiful woman. She's obviously getting on in her years. Instagram is a toilet bowl of haters. And the bigger you get on Instagram, the more people out there who try to bring you down. And it's amazing. And I see this as nothing more than Catherine Zeta-Jones being on Instagram, and there are people who are jealous, and there are people who are going to drop a dime on her. It happens all the time. Haters are going to hate. it's pretty blasé to me on Instagram.
Listen, I think Catherine Zeta-Jones is a beautiful woman. You know, she's definitely not where she was 20 years ago in terms of looks. It looks from the pictures that were sent to us, she looked like she lost a little volume in her face. And again, you know what? People are going to change over time. And when you're in a movie, you're made up with 3 hours of makeup many times for your scenes. And an Instagram shot in your car like me right now may not be the truest picture of yourself. So again, I think she's a beautiful woman, and I think it's enough time spent on this stupidity.
Who cares if she had plastic surgery, right? She looks good. Whether or not she had plastic surgery, it's not a crime to have plastic surgery. I don't understand what these people are talking about.
Well, first of all, she's, to Dan and Jason's point, she's absolutely gorgeous. And if she had plastic surgery, she's just a person who wants to look as good as she can look. I think she looks natural. I think that I think she's a gorgeous woman. I think she's actually a person that's a good example of good plastic surgery, if in fact she had it. But I don't see anything wrong with that. I mean, every day we help people with how they look, which improves their self-esteem. And it's no different than trying to stay in shape, right? So it's good to stay in shape. We know from society that in terms of what's good and what's bad, that it's a good thing if you work out and you stay in shape, keeps your heart and your respiratory status good. And what's so bad about using plastic surgery as a means to looking as good as you can look? And so I applaud her for it. Because obviously it's a way of our life. So as long as it's done not to excess and done in good taste.
All right, let's go to this last story. I want you guys to count the red flags in the headline. Ranting woman strips down to underwear in hospital lobby. Seriously? So this apparently is somewhere in China. The lady was unhappy with her operative results. So she went into the hospital where she had the surgery, stripped down her underwear, and started to rant about how bad her result with multiple complaints. Jason, lead us off.
People are crazy. You know, that's the bottom line. We deal with a lot of crazoids, and the older I get, the more crazoids I can accumulate in my brain that are in my practice. So, you know, we have to try to figure out who to not operate on. And I always poo-pooed those lectures at the meetings from some of the older plastic surgeons, but now I wish I could go back in time and figure out who not to operate on. There's a lot of things that were red flags with these patients. So again, you know what, the older I get, the more wary I am, but I still make the same stupid mistakes of operating on people I shouldn't.
So Dr. Pinsky, if somebody strips down their underwear, does that get your attention more, or you listen to their complaint more than you would otherwise?
No, I don't think it does, Bill, but clearly it throws up a red flag that, my goodness, wouldn't you hope that you could identify that patient before you ever agree to operate on them, because that's a reaction that that type of acting out is well beyond what would be considered acceptable behavior. So that's a bit extreme, and wow. I don't know what to say about
what do you tell us this though? What do you tell your patients? Because, you know, it's not plastic surgery is an art and a science. There's no 100% guarantees, but generally people do really well. But there is always a chance somebody could have to have a revision. What do you tell your patients about that? Whatever the procedure may be, I'm sure it's different, but what's your general comments on that?
Well, you know, I think that what you're saying is true. So what we do is an art and it is a science, but everyone is different. Everyone heals different. And it's not like making a birdhouse where we cut every piece of wood on the roof exactly 12 inches. And different people heal at different rates. And I think that this is really about setting expectations with patients and trying to deliver on reasonable expectations.
We gave you the last word on this because I know you're going to pull the silver lining out for us.
Yeah, so two things real quick. One is, this is partly about patient education. I mean, yeah, we want to avoid the crazies, but when you see a patient early post-op, for a week post-op, just to make sure there's no hematoma, infection, you know, acute problem, often, you know, they'll complain about the cosmetic result. And I think part of this is to educate the patient, to say, look, I'm going to see you a couple of days after the surgery just to make sure everything's okay, but, you know, your cosmetic results is going to take a while, especially in what I do, which is fat transplantation. Now, maybe in breast aug, it's more like WYSIWYG. What you see is what you get. If it looks good at 3 days, if it doesn't look good at 3 days, there's a problem. But in fat transplantation, there's often a lot of swelling. So I think part of it's just education. The second thing is, when you live in a country of 1.3 billion people, you got to figure some way to stand out.
Great comments, great insights. I'm sure the viewers really enjoyed it. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.